Thanks, Nilesh. I'll thank everyone present here and DOC and AIOS for giving me the opportunity. So I'll try to keep it simple, discuss the fundamental principles of research, rules of robotics, what is the simple process of AI, and what are the challenges we face with AI, and challenges with authorship, plagiarism, and what online tools we can use to enhance our research. So basic principles of fundamental research ethics are that we should respect persons and there should be beneficence or non-maleficence. That means patient should not be harmed, and there should be justice. That means the control arm and the intervention arm should be judicially planned. So Asimov's three laws of robotics say that robot should not injure a human being, and robot should obey the orders by human, and robot should protect its own existence unless it conflicts with the first or second role. So AI, actually what AI does, it gathers the data, there is input, then there is processing by machine learning and neural network, and then it can perform tasks, so it can generate data or distribute data. So what are the challenges? Challenges are that while you are training the machine, the ownership of the data is one challenge. Specifically in healthcare, who owns the data? Like there might be multiple stakeholders, including patient, healthcare providers, the organization, and the data analyzing company. And there can be, like, in profitability also there may be shared stakeholders. So privacy and protection of data are very important settings. In European Union and USA, we do have multiple guidelines. Cyber security and leakage of the data is another thing, and data should be shared with privacy. So another thing is how accurate is the machine. So their machines can hallucinate. There was this in Medscape, this article came. They saw that ChatGPT provided correct answers in around only 29% cases, and it incorrectly reported black box warnings, which are very which can actually harm patients. So we cannot rely clearly on machines, and the transparency of the process, how it is processed. It is usually patented or usually proprietary information by large tech giants, and there is the intelligibility or understanding of the process is difficult and not possible if you are not inside the organization, and this creates a black box phenomena, like what we do not know what is happening inside the AI and how it is giving the response, and if something wrong happens, it is difficult to correct because you are not knowing what is happening, and the bias of the data can come from the data itself, from where the data is generated. So definitely there are issues of patient privacy, patient consent should be taken, and if the data is again there should be clear mention about how the data is processed, and does it need repeat consent if it is sent to some other party, and there can be possible harm of also. As I said, there can be AI can hallucinate. So physician related issues is that though it has not happened now, many people might depend much more on machines than themselves, and they as it is coming that people are thinking that machines might replace humans, and trust and empathy are something which machines lag as of now. So also, can we put accountability on the AI? This is one fact for which authorship, most of the journals do not allow AI to be author because they cannot take responsibility of the AI, and costs are huge, and there is a possible chance of harm to humans. So this is there have been multiple articles which try to include ChatGPT or similar chatbots as author, but subsequently when this article was published, ChatGPT was removed from the article, because this ICMJE, they provide guidelines for authorship. In authors, for you to be author, you have to contribute substantially to the work. You should draft the work, and you should approve the work, and you should be accountable and responsible for the data. So if you cannot be accountable, then you cannot be author. So plagiarism, this is like there are some, if you are using some other person's data and you are passing them as your own, that then it is a plagiarism. There are multiple AI generated tools which can paraphrase that content so that it is not detectable by standard plagiarism detection tool. So there are multiple criteria by UGC which punishes if you are plagiarizing. So this is a sample authenticate report, and their publication is not just something you cannot publish anything, because there are certain guidelines, and there are sites like PubPeer or Instruction Watch which are screening the data and seeing if there is any scientific misconduct. So I use ChatGPT, Notion, Zotero, Grammarly, and Elicit for my writing. So thank you.
So thank you, sir. So that was a very, I think it is a very elaborate topic with so much incoming into the in AI space. Recently, I was hearing an interview of one of the startup founders, and he was telling he has this idea, what you talked about, where they will feed up their doctors will rely more upon AI to diagnose the patient. So his idea was, every time I go to a specialist with fever, he just gives me Dolo. So why I have to like spend a day and do this? I just can enter my symptoms into, I can select the symptoms in an application, and the application will tell me what drugs to use. So I think that is the abuse of AI that happens. And Dr. Pratyush, any comments on this?
So during my dissertation, I have used ChatGPT 3.5 to some extent, but not like the whole dissertation. But yeah, it can be used to fill up spaces, but we cannot rely upon the results from the ChatGPT.
And also the accuracy is not correct, because
Accuracy
the
is
data,
not correct.
the data on which it is like a generally available website data. So professional
correct.
data or ophthalmological related data is not there.
Not correct.
So you will not get good scientific content, or you cannot rely on that कि ये मेरा बना देगा सब कुछ. It is not there. हो नहीं पाएगा अभी तक. Thank you.
I'd just like to invite Dr. Digvijayan's opinion. Sir, if we train an AI model with scientific, like what sir is saying, it is all off the website. But if we are training the AI based on the articles that have been published for like last 100 years in ophthalmology, will it be ethical? I'll just ask your opinion and then sir's opinion on that.
I think two aspects. One that AI is as good as the data that you give it, and two, medical science especially. This is a very much of a gray area. I mean, you can get one article for something and one article against something. So you will have to really think in terms of what is the strength that you're going to give it, for each of the articles, as in which article does it accept more and things like that. But as far as using it for, from a screening point of view, as long as it's just the first step and it's supplementing your work, I suppose there it's going to do a good job.
There are sites already doing such work. Elicit.org or elicit.com is a site in which actually you can put your data, put your research question. It will give like top 5 or top 10 articles which have been cited maximally, and it will generate a like summary of that. So there are multiple AI startups which are starting, and they can give you what you want. But and also this PubMed database, like PubMed Central and PubMed database is one huge database. If some AI can actually capture all the available data which is available in PubMed, then actually it can generate a reasonable response. So
will you accept that article if it is generated from AI?
no, actually human has to intervene, because AI cannot take responsibility. In the last it will write that please use your judgment, or AI response can be wrong. So that is one thing. It is generating something, but you have to be responsible for that. If you are responsible, if you read that, and if you think that this is okay, you write in the acknowledgement that this data we took help of ChatGPT by OpenAI for production of this data, That's it, and we take responsibility of the work.
So,
for example, I mean, if you look at just NAION itself, right? So there, I mean, if you were to look at treatment of NAION and you put it on ChatGPT, or you want to see, it'll pick up a lot of the studies by Dr. Son Singh Harre and all, which were patient choice studies, which are not exact. And today we know over time, and though we still don't have a proper RCT, today we know over time that things have changed, and we no longer really follow those blindly. But that is among the top answers that it gives you. And so if you're using that to whether it's in your clinical, or you're using that to cite it in your own paper, you have to really look at it. It's not. I mean, I think as of now we still haven't reached there.
And also you can write in ChatGPT, if you are asking something, you just ask, please give me an idea of treatment of NAION for ophthalmologist in a professional tone with references. तो आप अगर ऐसे डाल देते हो, specify कर देते हो, तो it will give references, and you can say like 5 sentences or 10 sentences. It will actually generate a summary along with references. तो ये आप कर सकते हो. The comments or prompts are very important.
hi. So